73-year-old Heather Reid supported the Melbourne Demons her whole life. The club's song was the last thing she heard before she died last Tuesday.
So I sobbed and I sang the Melbourne theme song down the phone. And I told her that, that we're going to miss her and we're so proud of her and she fought really hard, and it's just a hard time that I couldn't be there by her side, to say my final goodbyes. It was really tough.
She's one of at least 7 residents at the Dootagala Yarraville village who died from COVID-19. The fun-loving woman, even last year, was in good spirits despite her Alzheimer's.
The rumour is that you started getting ready at 6 a.m. this morning. That's true.
Heather Reid initially tested negative.
So the second round of testing, my aunt came back positive. Then I was told that they were going to move the positive cases to another hospital. They weren't sure which one. But when she got into the hospital, because of her Alzheimer's, it's all unfamiliar for her, and she couldn't understand why I couldn't come into the hospital.
ICUs are pretty scary places anyway. And for an older person, and particularly an older person with dementia, it can be very challenging. There's noises, there's beeps, there's flashing lights. They may not be able to have any support person with them.
Anger at the aged care system for some families today turned to legal action. 30 families with relatives who were residents at Melbourne's Epping Gardens have filed a class action against the operator Heritage Gardens after 205 staff and residents were infected.
224 active cases currently, so aged care remains a significant challenge to us, and that's why everybody's working together as closely as they possibly can.
Yeah, so I think taking some of the equipment out that we don't need and maximise the space in the room.
The challenge for frontline staff like Dr Brendan Murphin in hospital ICUs like Monash Medical Centre is the complications old age can bring on top of the virus.
The chief thing that we ask ourselves about when they come in is have they had a discussion at all prior to coming to intensive care about what it is that they are happy for us to do? In terms of the levels of support and particularly around resuscitation status, because people, when they get to an advanced stage, do start thinking about not wanting to go through painful processes.
Doctors too are isolated from their loved ones.
My wife's in quarantine after an exposure from work at another health service, and we're missing her. I think we get to speak to her every day on the video conferencing, which is good.
Victoria's lowering case numbers today is welcome news here.
Morale at work seems to be a little bit better despite more changes. People are dealing with the low numbers, I think, in a positive light. Hopefully we can continue to see bringing staff back into their happy place at work.
What we're seeing happening in the aged care sector in Australia and in other clusters in slightly different settings around the world, such as abattoirs, such as choirs, Zumba classes, etc., shows the possibility of large, rapid outbreaks occurring, large, rapid clusters with this virus.
As the dire extent of Victoria's aged care clusters is revealed, efforts are underway in New South Wales to prevent a new cluster amongst the young. Today, New South Wales introduced new restrictions on school sport.
Very strange, especially if no spectators around. There's no cheering sound, especially in the senior games, there's no spectators at all.
Community sport fear they might be next.
Complied with the government's regulations. Since we came back to playing sport in mid-July, a COVID plan was put in place. That's extra work, extra time, and there's an extra cost involved, whether it's buying disinfectant through to signage, through to a whole range of other things that we're having to now do.
Any sort of mass gathering of young people where they might be shouting, laughing, generating lots of droplets, All these have to be taken into consideration.
Back in Melbourne, Sheena Hickman is writing a eulogy for her aunt's funeral tomorrow. A bittersweet day for her family, many of whom, due to COVID-19 restrictions, won't be able to be there.
She loved to have a glass of wine, and her funeral on Wednesday, I'm actually calling it her happy hour, because I want her to be remembered, you know, in a nice way, and because obviously the way she went out was not the way that we thought.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.